Welcome, everyone, to today's Talk Polymath episode. I'm Trenny Casey. This podcast is sponsored by Polyplexus, a platform for scientific and technical creators focused on accelerating interdisciplinary, innovative ideas through evidence-based conversation. It's free to join at polyplexus.com. All right, let me introduce you to our Talk Polymath guest today. We are so pleased to have Dr. Renee Wegerson, the inaugural director of the Advanced Research Projects Agency for Health, known as ARPA-H, with us today. She's going to give us some insight on ARPA-H's search for revolutionary, evidence-based ideas and bold thinkers who have what it takes to change the future of health, their vision for reimagining the state of health in the United States, and their new Dash to Accelerate Health Outcomes, which is ARPA-H Dash event. Renee, welcome. Thanks so much for joining us.
Hi, Trenny. Thank you for having me. Really excited to be here.
Yeah, well, let's start with the big vision. What has ARPA-H as a new agency? What have you guys been tasked to do?
Yeah, so last week marked 1 year since President Biden really shared his mission for ARPA-H to be a place where you can really pursue those big, audacious goals in health and create a place modeled after DARPA, the DARPA business model, where we could take those big shots, take those big risks, but move with the urgency, but also in a streamlined way with less of the bureaucracy that we might be used to in the federal government. And so in his vision, we are here to be a catalyst for the entire health ecosystem in the federal government and private sector, candidly, to launch the next moonshots, right? So, of course, we'll contribute to the cancer moonshot, but what are the moonshots for the next diseases that we may be able to catalyze as part of ARPA-H here?
Renee, what brought you to ARPA-H, and how do you define your mission there?
Yeah, so I joined ARPA-H about 5 months ago. President Biden swore me in, or actually appointed me, and I was sworn in by Secretary Becerra, who is my boss, for a really unique model. We are established inside of NIH, but to create some of the independence and autonomy, I do report directly to Secretary Becerra. And so what that really allows us to do is take some of those really big risks. But before we could take those risks, just like any other startup, we have to actually, create the business. And so in the last 5 months, we've been, bringing on board the contracting team, our budget team, HR, everything that you can imagine to run a business, we needed to have in place so that we can be ready to welcome and hit the ground running once our technical team, the program managers and the leadership of the mission offices, could be here to launch. We did highlight a few technical areas to start. First, our mission statement itself, which is to accelerate better health outcomes for everyone. What's really important there, I think, is the phrase health outcomes. The measure of our success is that we change the game. We change standard of care. We extend a healthy lifespan for people if we're successful. And so over time, those will be the way that we really measure our successes for ARPA-H.
Wow, that's amazing. Obviously, health, Renee, is an enormous endeavor. You do have some focus areas you were using to guide initial funding. What do they represent?
Yeah, so what's important to know about the ARPA model is it's a bottoms-up model. So we look for program managers that are not only great doers, people who think and act like CEOs, but they come to ARPA-H with a big problem in health that they want to solve. So we're in hot pursuit of those folks, bringing them on board now with those, very specific problems. But from a high level, what we've done, the leadership at ARPA-H have identified focus areas that to us identify 4 big buckets of health where we think further investment can really advance the state of the art. So this could be what we hope would to inspire program manager or a cohort of program managers to launch programs in those areas. And so the first area is health science futures. This is expanding what's technically possible. Think of, molecular platforms all the way to hardware platforms that advance a number of diseases that can be agnostic, but we may pursue cancer outcomes. We may pursue diabetes outcomes. All of those are within scope of that focus area. The second is scalable solutions. So how many great proofs of concept have been in the lab, but never made it out of the lab and into the real world because of manufacturing challenges, or they haven't figured out a way to make it simple to use at home. And so scalable solutions is really meant to bring things out of the lab into the real world, accelerating maybe where there's already a proof of concept, but we want to bring that to our customer, the largest customer base of any ARPA, which is ARPA-H's customer base, all Americans. proactive health, so keeping people from becoming patients in the first place. How many preventable diseases, chronic diseases that afflict Americans every day, that new behavioral, social, diagnostic, detection paradigms can really change the state of care and extend a healthy lifespan. And then finally, at a systems level, resilient systems. How are we thinking about preparing for the next pandemic or economic crisis or even climate crisis so that, we're not building for any one specific problem, but a very dynamic healthcare system? We think there's a data layer that's missing that we can start to build for health, but also just integrating some of the new innovation that's happening across the sector, getting things across very quickly to a clinical trial, making sure that those in communities that maybe don't have a healthcare center right down the street are still going to be able to access care in time of crisis. So again, big areas in health, big levers that we think further investment can pursue, but you can kind of get a flavor for the type of scale and magnitude of the challenges that we want to solve. So these are not, tiny little proofs of concept. These are big paradigm shifts in health that we hope to pursue.
Yeah, as we just said, a really big endeavor. So in your mind, what are some of the primary challenges that ARPA faces in seeking to improve health, and how can the agency overcome them?
Yeah, so I think, some of the challenges is some of it is just a mindset to how we approach the problem. And so a lot of my job in the first few months had just been sharing with the rest of the healthcare community, what is the ARPA model? So, having this become from a program manager, a lot of the ideas is a really interesting concept, but letting folks know, the ARPA H- is a great example that we're listening to communities as well. We want to hear, what are the problems that you're facing? What is a new insight that you might have heard about that you want to bring to us? We can be a champion for those ideas here internally, and start to catalyze. We won't know everything, right? And so we need to actually really be great listeners to our customer, immerse in some of those ideas, so that we can move forward. And that's been one of the big challenges, I think. The other challenge is just getting folks comfortable with the idea of, if we're doing a big enough audacious program, if we're shooting for the moon, we're going to fail sometimes, and that's actually okay. And it's a signal that our organization is moving in the right direction, that we're taking bets that are big enough that can actually, change the state of the art. And when you take such big bets, sometimes you're going to fail, but it's really important to fail fast, fail transparently, so we can all learn from it, be a learning organization, and share that with the general public.
Yeah, failing sometimes leads to bigger successes. All right, so let's talk about the Dash to Accelerate Health Outcomes event. The ARPA H- is a collaborative and competitive effort that uses a bracket framework to invite new ideas based on scientific evidence. Tell us more.
Yeah. So, one of the insights that we've had in standing up ARPA H is that the general public just doesn't know about us. And some scientists that might have great ideas just aren't familiar with the model and how we think about things. And so approaching the ARPA H- we wanted that to be an opportunity to not only get people thinking about our model and how we think about and digest ideas, but genuinely, bring in new ideas that we might not have already from program managers. So this year, I hope to hire about 20 program managers. And so we're not waiting for them to arrive to think about what are the ideas and big projects we can work on. We're ready to, contact the broader community and do that. And so who's eligible to participate? Really, this can be anyone in the United States, right? So they can be scientists. They don't have to be scientists. They could be students. They could be patients. They can be caregivers. But what's important is not only do they have an idea, but they have an insight about some of the evidence so you mentioned evidence-based pursuits earlier. And so that combination of here's my big idea and here's why I think the time might be right now to move forward. And what that's doing is also training folks to how we think about problems. So we do have a framework called the Heilmeyer questions that we've adopted largely from DARPA, but we've made them our own, starting with questions, the 3 questions that are also reflected in the ARPA H- challenge. So what is the problem you're trying to solve? What are you trying to do? How is it done today? We want to challenge the status quo. And then what's the new insight? What's the evidence that there's something new here? So every program manager that walks in the door at ARPA H is addressing at least those 3 questions plus additional ones about milestones, costs, timeline. So it's really working with the public to bring them around to our way of thinking about things, which we hope will be a very productive interaction as we move forward.
That's amazing. And this is actually kicking off within the next week. So for those listening, here's what you need to know. Submissions open on March 29th and they remain open until April 7th. All you need to do to participate is register at polyplexus.com, submit your idea within those 2 weeks, and then when the voting opens on April 7th, get involved, vote for the ideas that you are most excited about. Each round will be open for a minimum of 3 days of voting and then discussion before the next bracket is revealed. And this is the best part. There will be a $15,000 grand prize awarded to the winning transformation and additional prizes to a runner-up, 2 semifinalists, and 4 quarterfinalists as determined by the judges. Participants who select the most winners in head-to-head comparisons are also eligible for prizes as well. If you want more info about DASH, just visit arpah.gov, or you can also visit polyplexus.com to register. Obviously, that's a lot. You talked about who you are hoping will participate in DASH. You said it's open to everyone. So what do you hope that ARPA H DASH will lead to? And what do you think you'll end up doing with the winning ideas?
It's a great question. I do really want to expand the base of people who know about ARPA-H and start to think about us as part of that ecosystem. If something is so bold and audacious and high risk that it doesn't seem like the commercial sector or the rest of the federal funding enterprise can take on, well, there's a home now for ideas like that, and that's ARPA-H. And so I want that to be in everybody's mind. But also, really importantly, this is a genuine prize challenge. This is not R&D funding. Do the work. We want to, reward the public and those that are engaging. Like, what are these big ideas that we could pursue? We have separate solicitation and ways to work with us for R&D funding, but this is genuinely like, let's have a prize challenge to generate some excitement on these topics. And then what might we do with these ideas? So any new program manager that starts at ARPA-H has to do some discovery. So there's a big problem that they want to solve, but they're not all knowing, right? They don't know about maybe the payers, the stakeholders, what's the limit in the technical state of the art. And so these ideas give us a foundation to start to do some of that discovery for potentially future program managers. If we're really excited about an idea, we may start to recruit in that area. Or we may bring in new ideas to an open BAA solicitation, which is our jargon for our R&D funding. All of these are completely on the table, but we want to take action from these ideas. So, again, we are a service organization. We are public servants. We are in service of the American public. And so we want to hear what are those big ideas that you want us to be able to pursue. And this is a chance to be able to share that.
What is the one thing, Renee, that you'd like anyone who's listening to this podcast to take away about ARPA-H and its mission?
We are here genuinely to serve all Americans. So if you look at the ARPA-H DASH and think it isn't for you, please look again. We really want to hear across all walks of life, what are the challenges that you face, so that we can start to work on some of these really, really hard problems. We know that success might be 10 years, might be 15 years out. That's okay. But what are the kind of, cornerstones that we need to lay down now to solve some of those really big challenges? I think that's exciting. And the other thing is, we're trying to create a startup vibe with this organization. It is a startup within the federal government, but we know that we're here to be a transaction, a catalyst, and things need to leave ARPA-H. And so we want to be dynamic and able to work with the public, work with the industry in a seamless way with very limited bureaucracy. And this is just with the ARPA-H DASH another way to do that.
And just to remind everyone, it's open to anyone. You don't have to have a science background. You just have to have the willpower and the knowledge about what you want to accomplish, right?
That's right.
So Renee, it's open to pretty much anyone who wants to participate, and it's really easy to get involved, right?
That's right. We want to make this as simple as possible, low barrier to entry. There's a simple form fill on the website that you can answer those 3 questions, give a punchy title to your idea that is then what's going to be the very public-facing part of this as we go forward.
Well, Renee, thank you so much for joining us. And a final reminder to our listeners to get involved in the ARPA-H DASH. Please do it. You can find the rules and submission. As Renee said, it's really easy. Find that submission form on polyplexus.com.